Hello, everyone. This is training session number 5. We're going to talk about some other optional health benefits that some clients may want because they don't provide insurance at all, or they have a limited liability plan, or some of the employees have not participated in the program. So I'll first talk about a physician and hospital benefit, because most people who have insurance have a discount on physician and hospitals built into that. But if not, keep in mind that somebody that doesn't have insurance probably can't afford any kind of specialty physicians or hospital care, which means they could end up getting into more and more serious medical situations. So what we have is one of the largest physician and hospital networks in the nation. We use Galaxy Health and what's called Beach Street. And with that, individuals can save 10 to 40% at over 300,000 specialty physicians and thousands of hospitals and urgent care centers nationwide. And they can save on anything, including cosmetic procedures. There's no restrictions whatsoever. It's a toll-free number, so when somebody has this benefit, they call the toll-free number, tell them what they're looking for, and this service will help them find it, negotiate the arrangement, make the appointment, and they can go in knowing that there's not an unknown cost. But in addition to that, we typically package together the medical health advisor benefit, because not only can this help people ahead of time find the best doctors, the best hospitals, and other providers, but they also help them just navigate the entire healthcare insurance system. It's very confusing for most individuals. When people do get medical bills, most of us can't figure it out. They'll work with the consumer to help resolve billing issues. They will find current treatments for certain medical conditions. Bottom line is they're going to help all of us make informed medical decisions. They'll help us schedule appointments. They'll help us get second opinions and find best-in-class medical institutions for our conditions. It's a pretty invaluable benefit that if somebody's going to get the physician and hospital discount, I recommend they get these two combined, because then you get the most bang for the buck. Okay, another benefit is called telephonic counseling. What many of us have heard in the healthcare field is employee assistance program, which is having access to counselors, by phone for, problem resolution. And typically, this benefit, companies that get it might pay $4, $5, $6 per person per month to have this benefit for all of their employees. We're working with APS Healthcare. They're one of the largest in the nation. They've got 22 million people who use their service. We can add this benefit to any of our programs for an additional $1 a month, $1 per person per month. So if a company does not have an EAP and they like our core benefits and you happen to mention that this is available, you can just add $1 to it and they have it for every employee. All the counselors have, master's degree, 5 years postgraduate experience. They're available 24/7. And they can work on a multitude of issues, from depression, anxiety, and stress to conflicts at home work, reliance on alcohol, drugs, tobacco, or food, abuse issues, loss, grief issues, changes in transition. I actually embedded this benefit into a program that we offered for students at colleges. The colleges absolutely love the telemedicine. They like the dental and the vision, and they like the pharmacy, and they like the telephonic counseling here, because they thought a lot of kids, are going through big changes in life, and this could be a lifesaver for them. So keep this benefit in mind. And then for companies who might have employees who are traveling, all over the country to do different jobs, or even out of the country, the Travel Assistance Program, once again, this is another benefit that if somebody was going to buy this benefit on a standalone basis, it would probably be close to $300 a year. We can add this in for $1 per person per month. And people who are traveling, once they're more than 100 miles from home and they have a serious injury or illness, they have physicians, travel assistance personnel, and emergency evacuation benefits available to them. So it's a tremendous benefit that can help give peace of mind to employers who have employees that are traveling all over, and to those employees who know that if something happens, they can be shipped right back to home to be taken care of. So these are the other optional medical benefits. We'll talk about lifestyle benefits next.